Hey guys, Don here. I like to kind of share this marketing journey that we're doing in the office. And so recently we had our office meeting this morning. We do our office meeting. I don't know how you guys do your office meetings, but we do ours via Zoom now because we have two offices. We used to do them in person. And we took a time and we do it every Thursday morning at 7 a.m. And that's the time before our days get busy. And that's something that we implemented a few years ago, and it works well because what we used to do in terms of a meeting together is we just met whenever we had time, and that usually was like between patients when anyone had a little bit of time or we stayed late, and that really didn't work. And we didn't want to take away time from the open office, so we do it from 7 to 8 in the morning. And today we had someone come in and show us a laser because we have our office in Worcester. We have a Cutera. And we use that for warts. We also use Cantharidin, but some patients just don't like how much Cantharidin hurts, so we use our Cutera. Cutera is really expensive, and so we're looking at another option. And today we had someone present about the Remy laser, and that's the one we're going to go with. And so I don't know if he's watching right now or listening to this right now, but a couple of things I learned about the Remy. We really wanted it just for the warts. And I know it's expensive to spend like $15,000 for a wart laser when you can use Cantharidin, but it can be used in other things as well. It can be used for pain. Currently, we're not doing it for pain, but we may consider it, especially if we can use it for staph. And it can be used for fungal nails. Once again, we tend to use Lamisil more. We use it a little bit. We have Lunula, and we're going to try this one for it. I don't think any of them are really great, but it might be an option if we can train our staff. That's the whole takeaway would be, is there a way that I can train my staff to do it for pain and for fungal nails? That would be a cool thing because I could charge a little bit less and I really wouldn't have to do it. So that's the first thing about this meeting. And so in the meeting, we got the quote, and the quote was, I think they gave us it was like $15,000, and they brought it was $16,000. They brought it down to $15,000 when they sent the quote over, and then they offered like 1% financing. But we just tend to buy things outright, and so I called them, and for a 10-minute phone call, I was able to get the price down another $1,000 because basically they were going to have to pay a point on that interest. They're giving us like 1% interest. They would have to pay for that, so they just gave it to us. So that's another thing is always ask, even if they say they're giving you the lowest rate, ask them if they'll go a little bit lower. So that's one thing that we did this morning. So we bought a new laser for our new office, and that'll be arriving. We'll kind of get used to that and try using it on pain. If any of you guys use stuff for pain and you really like it, please let me know. I'd like to hear about that. Currently, we're using Shockwave, and that's working really, really well. And so I don't know if this would like replace Shockwave. So anyone that uses laser and Shockwave, I'd like to know how you kind of do that. So my email is don@Podiatry Practice Mastery. We could even do a little podcast together asking and answering questions on that. The other thing that we did today is, I think I've talked to you before about this newsletter thing that we wanted to do. And we were talking about marketing this morning. And with marketing, we were considering like a billboard, which ends to be like $3,000 per month. Then we were looking at some other marketing. And the whole challenge with marketing in terms of getting in front of primary care doctors is that we can't get in front of them. We don't have their emails. We have their addresses, and we don't want to spam them with faxing stuff. So what we're trying to do, and I learned this from a physical therapy group in town, we're doing something called a physician newsletter. And basically this is a newsletter that we're going to send to our top 100 or 200 primary care doctors or people that are influencers. And this could be primary cares, this could be, let's say, physical therapy places that we refer to or that we send patients to and they send back. It could be to other places, normally within doctors because it's called physicians, so probably more with physicians or doctors or something like that. So we're doing this. It's really short money if you're considering it. Let me know if you want to know the company that we're using. I may have already told it before, but I don't want everyone to use it because I think they'll all be getting, all the primary cares will be getting the same. Actually, you know what? What I've learned with marketing, no one's going to really do it anyway, so let me give you the name. It's called Newsletter Pro. That's the one we're using. It's a year contract. It is $150 to set up and then $150 per 100 letters. So that means one letter is $1.50. That's including postage. That's super cheap. So let's say we send it to 200 doctors, or let's say 100. That's $150 a month sent out once a month. We can change some of what they call the copy or the wording on it, and really excited about doing this. basically because I don't have to do anything. That's what I'm really excited about, because they lay it out. I just give them maybe a picture and one patient testimonial from Google, and it goes into the primary cares in front of them. Whether they get to them, I really don't know, but it's kind of a neat way to send something to influencers as well in the community to keep you front of mind. So $150 is pretty cheap for that. We do not send one, once again, to all of our patients. I think I've talked about that before. What we do is this 3-minute newsletter or video newsletter. And I had a patient comment today, and she said that. She said, I get a lot of emails, I get a lot of newsletters, but I don't have time to read all of them. But I said, well, I got 2 minutes. And this patient, she watched our last 2-minute video, and she came in for Cariflex. That's that fake nail you put on top of the nail. And I think 3 of patients that came in for that today, and 2 of them came from that newsletter. So something to think about. If you want to do a video newsletter, it's really easy. I explained it in a previous episode, and it's on podiatrypracticemastery.com. If you kind of register there, you can see that. I explain how to do it. It's real easy. If you can't remember, you can just email me. I'll happy to explain it. But we do the 3-minute newsletter, and I talked about Cariflex, and patients came in for it. So just kind of giving feedback of what's working for us. I'd love to know what other people are doing. I'd love to interview you guys for the interview series, or even talk in this podcast. If you're passionate or interested, or you want to share a tip with me, send me an email. Hey, Don, this works for me. If you don't want to do the audio, you can just tell me, and I'll tell other people. Okay? Great. Okay. Have a nice day, guys.